Your belly feels tight, round, and uncomfortable, and you're wondering, is this constipation bloat or gas bloat? That question matters, because the first thing you try can either help fast or make you feel worse. Constipation bloat is usually about traffic jam stool. Gas bloat is usually about trapped air and pressure. They can overlap, but your body often gives clues. In the next few minutes, you'll learn simple checks you can do without guessing. You'll also learn what to do first for each type, using low-risk steps. No extreme cleanses, no complicated supplements, just practical moves that match what's likely happening. And if you've been told it's just IBS, this can still help you sort patterns. Let's start with the fastest way to tell them apart. Moving to slide 2. First clue, how quickly the bloat shows up. Gas bloat often builds fast. You can feel fine, eat a meal, and within 30 to 90 minutes, you're suddenly tight and gassy. Constipation bloat is usually slower. It tends to creep up over a day or two, especially if bowel movements are getting less frequent. Second clue, where you feel it. Gas bloat often feels higher, like upper belly pressure, burping, or a balloon under the ribs. Constipation bloat often feels lower, like fullness below the belly button, plus a heavy or stuck feeling. Third clue, what gives relief? Passing gas, burping, or a bowel movement that empties well tends to improve gas bloat quickly. With constipation bloat, even if you pass some stool, you may still feel incomplete. That not done yet feeling is a big hint. Moving to slide 3. Now use a quick symptom checklist. For constipation bloat, look for fewer than 3 bowel movements per week, hard or lumpy stools, or straining. Also watch for the feeling that you can't fully empty. Another common sign is needing to push a long time, or relying on perfect timing to go. For gas bloat, the key signs are frequent belching, lots of flatulence, and crampy pressure that moves around. Gas pain often shifts location. Constipation discomfort is more steady and heavy. Also pay attention to sound and sensation. With gas, you may feel gurgling, bubbling, or sudden sharp twinges. With constipation, you may feel dull pressure and a stretched feeling. If you're not sure, track one day. Write down meals, symptoms, and bowel movements. Patterns show up fast when you capture them. Moving to slide 4. Here's a practical self-check that's surprisingly useful. The morning reset. When you wake up before food, notice your belly shape and comfort. If you wake up already bloated and it stays most of the day, constipation is more likely. That can happen because stool and fluid are sitting in the colon overnight. If you wake up fairly flat, then bloat ramps up after eating. Gas bloat moves higher on the list. Next, check what happens after a complete bowel movement. If you feel noticeably lighter, looser waistband, and less pressure, constipation was probably driving it. If you go to the bathroom but bloat stays, think gas, food triggers, or sensitivity in the gut. One more clue, your appetite. Constipation bloat can reduce appetite because you feel full without eating much. Gas bloat may come with normal appetite, but discomfort after meals. None of these are perfect alone. Moving to slide 5, let's talk about why constipation creates bloat. When stool moves slowly, it sits longer in the colon. The colon keeps absorbing water, so stool gets drier and harder. That makes it even harder to move, so the cycle continues. Meanwhile, bacteria ferment leftover carbs and fiber. That fermentation produces gas. So constipation bloat is often a combo of backed up stool plus extra gas trapped behind it. That's why you can feel gassy, but the root issue is still constipation. Another factor is coordination. Some people have pelvic floor muscles that don't relax well during a bowel movement. You can strain, but the exit isn't opening efficiently. That's called a defecatory disorder, and it can mimic stubborn constipation. The key takeaway is simple. If stool isn't moving, gas doesn't move well either. So the first step often focuses on restoring regular, comfortable bowel movements. Moving to slide 6. Now the gas side. Why gas bloat happens even when you're not constipated. Some gas is normal. The issue is volume, speed, and sensitivity. You can swallow extra air when you eat fast, chew gum, drink through a straw, or talk a lot while eating. Carbonated drinks add gas directly. Then there's fermentation. Certain carbohydrates pull water into the gut and feed bacteria quickly. People often call these FODMAPs, meaning specific fermentable carbs. You don't need to memorize the list. Just know that onions, garlic, some dairy, wheat, beans, and certain fruits can be common triggers. Finally, there's visceral hypersensitivity. That means your gut nerves feel normal gas as painful pressure. So two people can have the same amount of gas, and one feels fine while the other feels miserable. The first step for gas bloat is usually reducing swallowed air and calming the gut after meals. Moving to slide 7. So what should you do first if it's likely constipation bloat? Start with the basics that improve stool movement without shocking your system. First, hydration, but with a purpose. Aim for steady fluids across the day, and consider a glass of water after waking. Second, gentle movement. A 10 to 20-minute walk can stimulate the natural colon reflex. Third, build regular timing. Try sitting on the toilet 10 minutes after breakfast, feet supported on a small stool, and relax your belly. Don't strain. Fourth, fiber, but slowly. If your diet is low in fiber, add one change at a time, like oats, chia, kiwi fruit, or cooked vegetables. Too much too fast can worsen gas. If constipation is persistent, talk with a clinician about safe options, like osmotic laxatives or magnesium products, because the right choice depends on your health history. And if you see blood, unexplained weight loss, or severe pain, get medical care promptly. Moving to slide 8. Let's make that fiber piece more precise, because it's where many people get stuck. Fiber isn't one thing. Some fibers are more fermentable, meaning they create more gas. Others are gentler and help form soft, easy-to-pass stool. If you're constipated and bloated, start with small doses. Think 1 kiwi per day, or a tablespoon of chia soaked in water, or a small bowl of oats. Give it 3 to 5 days before increasing. Also consider the type of meals. Big, heavy meals can slow stomach emptying and worsen pressure. Smaller, balanced meals can reduce that stuffed feeling. And don't forget salt and electrolytes. If you drink a lot of plain water, but eat very little salt, some people feel worse. A normal balanced diet usually covers this. If fiber makes bloat explode, that's useful information. It can point toward gas sensitivity, SIBO-like patterns, or simply increasing too fast. That's when a dietitian-guided plan can be worth it. Moving to slide 9. What should you do first if it's likely gas bloat? Start by reducing swallowed air and improving meal mechanics. Eat a little slower. Chew fully. If you're gulping water, switch to smaller sips. Skip straws and gum for a week as an experiment. Next, check carbonation. If seltzer, soda, or beer is daily, try removing it and see if your belly changes within 3 days. Then use heat and movement. A short walk after meals helps gas move through. Gentle belly breathing can reduce guarding, where you tense your abdominal wall and trap pressure. Now, food triggers. Don't cut everything at once. Pick one high-likelihood trigger for you, like onions and garlic, or large servings of beans, or regular milk. Reduce it for a week and reassess. If gas bloat comes with diarrhea, urgency, or a lot of pain, consider talking to a clinician about IBS patterns, lactose intolerance, or celiac screening. The goal is targeted experiments, not food fear. Moving to slide 10. A common confusion is the I'm bloated but I poop daily situation. Daily bowel movements don't rule out constipation. You can have incomplete emptying. You can also have slow transit with small daily stools. So ask better questions. Are stools hard? Do you strain? Do you feel finished? Do you need multiple trips? If the answer is yes, treat it like constipation first. Another confusion is the I'm gassy so I need more fiber assumption. If your fiber is already high, adding more can increase fermentation and worsen gas. Instead, focus on regularity, meal spacing, and trigger identification. Also watch for sugar alcohols. Sorbitol, mannitol, and xylitol, often in sugar-free foods, can cause major gas and bloating. And finally, consider stress. Stress changes gut motility and sensitivity. It doesn't mean it's in your head. It means the gut-brain connection is real. Simple downshifts like slow breathing before meals can change symptoms more than you'd expect. Moving to slide 11. Let's build a quick decision tree you can actually use. Step 1. Look at bowel movement quality. Hard, dry, or strained stools point toward constipation bloat. Step 2. Look at timing. If bloat spikes soon after meals, gas bloat is more likely. Step 3. Look at relief. If a full bowel movement improves things a lot, Constipation is a major driver. If passing gas helps more than pooping, think gas. Step 4. Try the matching first move for 3 days. For constipation, water after waking, a daily walk, toilet routine after breakfast, and a small gentle fiber add. For gas, slow meals, remove carbonation, walk after meals, and reduce one likely trigger. Then reassess. If you're clearly better, keep going and adjust slowly. If you're not better, don't just escalate randomly. That's when you consider a clinician evaluation, especially if symptoms are new, worsening, or waking you at night. Patterns matter more than one bad day. Moving to slide 12. Now, red flags and don't wait situations. Most bloating is benign, but some patterns deserve prompt medical attention. Seek care if you have blood in the stool, black tarry stool, or unexplained anemia. Also, if you have unintentional weight loss, persistent vomiting, fever, or severe worsening pain. New constipation after age 50 should be evaluated. So should bloating with a strong family history of colon cancer, inflammatory bowel disease, or celiac disease. If you're very constipated and can't pass gas, with intense cramping and swelling, that can be urgent. For women and people with ovaries, persistent bloating with early fullness and pelvic pain should be discussed with a clinician. These are not meant to scare you. They're meant to keep you safe. For everyone else, the most helpful mindset is, symptoms are data. Track them calmly. Match the first step to the likely cause, and give changes enough time to work before switching strategies. Moving to slide 13. Let's wrap this into a simple takeaway you can remember. Constipation bloat feels like backup and heaviness. Gas bloat feels like pressure and movement, often after meals. Your first job is not to label yourself. It's to run the right first experiment. If constipation is likely, focus on hydration rhythm, walking, a toilet routine, and gentle fiber increases. If gas is likely, focus on slower eating, less swallowed air, less carbonation, and one targeted trigger test. Give it 3 days, then adjust. If you want one personal rule, it's this. Don't add a bunch of fiber to a belly that already feels like a balloon. And don't chase gas remedies if the real issue is incomplete emptying. If you found this helpful, subscribe for more clear, practical gut health explanations. And comment with a forced choice. Which matches you more? A. Bloat that builds slowly over days. Or B. Bloat that hits soon after meals. This information is not a substitute for medical advice.